to follow these solutions and their impacts, right? So what about thinking wider? If it's a private solution, very specific, how do we structure, embed in a data governance, and really scale these for structure purposes? Dr. Egbe, if you can help me sort some of the chat questions.
I was just going to say, just because we are getting to the end and we had promised people sort of 90 minutes, I think we have taken sort of extra time. I would just like to say thank you very much to everybody who's attended, but please, you're welcome to stay on, and there will be a session in February. There are quite a few questions that we have not been able to answer, and there will be another session in February. And definitely we look forward to having sort of conversations and continuing the conversations with you. But anybody who wants to stay on, please feel free to stay on. But we just want to make sure that we are very respectful of your time. But some of the questions that have been received so far, one, there was a specific question around an instrument called taunting. I don't know, how do institutions, evaluate reliance on AI tools to evaluate students' work? And then the other issue was regarding justice and equity. What can be done about AI healthcare platforms that restrict usage by physicians outside a particular region? So the example given was open evidence, which was restricted to only US physicians. And the other issue, which I think, Toby, which we did not mention, was really how can you use your voice AI, or how are people are thinking about using this in training of both medical students or residents, and to bring the conversation back to sort of education. So I really think is, how do you sort of assess the use of AI tools in education? How do you deal with issues of which Professor Bebe had mentioned, limited access from certain countries to available information? And yeah, I think that's kind of a good place to stop, so we will answer those questions, I think. And we really look forward to sort of several conversations ahead. And also, I'd written in the chat, if anybody has suggestions of people you would like us to reach out to, please let us know. Thank you. Back to you, Dr.
Exactly. Thank you so much. So, Dr. Toby, if you can try that, how do we assess tools and the access challenges for scaling?
I think I actually didn't address your bias question earlier, like how do you, so I think, yes, we, particularly for AI deployed in like real life, like clinics, real like world settings, there will be mistakes, there'll be errors. And I think one disciplined way to track that is to just monitor these outputs. And so we have first of all, before we even deploy models, we have benchmarks. That's like, we have like an exam that the model must pass. So we define this is how well you should perform on this defined accents in these defined areas, on things like numbers, fractions, currencies, and things like African names, medical terminology. So we don't even deploy a model until it has passed that bar.
Okay.
I think the first pillar is to track bias, is to make sure that you are deliberate about or that there will be a bias. So, for example, this certain minority accents that exist in this hospital, how does this AI model perform on this language? So if you don't know that it exists, then you can't track it. So that's our first thing. And then I think we already like engage the medical community in training and even evaluating these models. So the folks who help us, who give us the data to train the models, are from the medical community. So it already provides like an opportunity for them to engage with AI and to even define AI. And also the team that reviews those outputs and tells us, because we're actually currently working on paper that shares like a framework for measuring like safety and severity of errors in like medical transcription. So people are helping us look at outputs and say this is a very dangerous output. This is minor, and so bringing it into the medical education space, I think involving programs, students in actual like AI projects during training.
Yes.
I think one of the things I typically recommend for curriculum development is to say, can like as a part of a course or an assignment or something, can students, residents, trainees, can they identify an actual problem in their hospital and try and design an AI solution to it?
Yes.
Have an AI expert like myself or whoever, Dr. Man, Yahil, to supervise or provide like feedback to whatever solutions they have provided. I think that helps people think practically, not just thinking about AI as something out there, and they can start to actually build solutions that are more relevant to their institution versus hoping for access to something like open evidence. Why can't somebody build something? Fine, the first version may not be great. Our own first version was not great, and that's okay. But people need to start to develop that discipline of creating an actual solution to a real problem that you can actually see in your hospital.
So thank you for that. Absolutely. And I think we've had also informal discussions with Dr. Minyahil around the importance of, having a sort of country or regional hub for AI. And I think the main question, and to close it off, to go to Dr. Minyahil, is the infrastructure has to be there, right? The data has to be there. There has to be governed and a way to structure and continue monitoring these impacts, right? So can you also comment, so in terms of making sure access is more viable if you have the investments, the resources needed to have that think tank model, right? Be it under government, be it to drive it. So resources are needed to make sure people have access to these knowledge. So and it's expensive. So for Africa to think, given all the priorities Africa has today, how do we, financially find those resources to build? And I'm in Canada, I'm in awe in terms of that think tank ability that's there and paces and outputs, right? So Dr. Minihal, just a little bit of, information around how do we equitably ensure access, infrastructure, knowledge to this AI, and people and students and all to be able to develop practically, right, in clinical settings. How do we, do you have any ideas, and how are you thinking of AHRI and other this lab sort of, integrating at the country level? Thank you.
Okay, thank you. I would also touch a point on public-private partnership model that you have reflected. That is one aspect to ensure access and equity. For sound financing instrument, we use both proactive and reactive financing solutions. Reactive, in a way, we apply for open calls and compete for global grants. And we have established the capacity of winning grants. Of course, one of the top institution in Africa, a top recipient of the global EDCTP program funds, the Horizon Europe funds, the World Bank, and other bilateral and trilateral funders and development partners. But funding comes with a burden, and the burden is to deliver the very best interest of the funder without compromising the project milestone and linking the outcomes and outputs learning of these particular projects to real-world healthcare setting. That comes with a key idea of sustainability. So resource mobilization, serving the very best interest of the funder without compromising the patient interest, uh, country values, and governance framework. But when it comes to the proactive funding, we liaison with various development partners, both within Ethiopia and overseas, and that is quite trustable and dependable way of resource mobilization.
Yeah.
The funder not only gives us an earmark amount of budget, they co-develop the project with us. In a sense, they are co-owners of the project, and they get value from that, working and sustaining establishment with the government of Ethiopia. For instance, in the context of Canadian government or the government of Canada, the Grand Challenge Ethiopia is a permanent recipient of the Grand Challenge Canada funding and technical support.
Yeah.
So how we sustain the partnership? We not only produce solutions, but we make sure that solutions are backed by strong governance. Solutions are, backed by strong experts, or in the context of AI, strong AI experts, both within the country and overseas, and also backed by frontline enthusiasts, frontline clinical providers. So these are the key aspects we need to look into. But when it comes to having on board the private sector, we need to make sure that the private sectors will make use of the AI solutions we provide to the public institutions. In our context, we have advised the government that during the scale-up, we will be providing this state-of-the-art AI solution for the private hospitals, and we will be training the AI solution from the data of the private hospitals. So the private hospitals will benefit from the AI solution, and our lab will benefit a data source from the private hospitals. So
Thank
they
you
will,
so
but
much.
for that
Yeah.
to bridge, they should purchase a state-of-the-art ECG machine by themselves. So for the
Thank
equity, we will provide the machine to the government hospitals and the AI solution to the private hospitals, and source the data from the private hospitals. So that way we will ensure the public-private partnership model.
Wonderful. Thank you so much, Dr. Miniahela. I would like to thank both speakers really for this wonderful conversation. Dr. Egbe, if I can hand over to you for closing.
Okay.
Thank you.
Thank you so much. We've already closed, but I think the conversation was so
Yes.
interesting that we had, quite a lot of folks sort of remain. And we thank you so much for sort of joining us. We know this is a very busy time of the year for several people, and that the conversation was so interesting that you stayed. As we had indicated, we're very open to suggestions on how the conversation can be continued and sustained, or the exchange in ideas. I noticed some folks from Ethiopia actually wanting to connect with Dr. Minahai. So we're very happy that we had a platform that as connecting people within Ethiopia to each other. But I think also really would like to say thank you to the speakers for giving their time at this very busy time of the year. We really appreciate it, and we hope you can continue to stay engaged. And to the moderators, thank you so much. I'd like to say thank you to the P2P team and the ANADAC team that also sort of put this together and sort of getting it out. And for all you people that joined the conversation, please let us, we really are very interested in your thoughts, suggestions on taking this forward, potential suggested speakers. And I know the speakers have given some of their connections or contacts on the chat, but if you want to reach out to any of the speakers, please let us know at info@anadac.com, or just respond to the Zoom thing on your email, and we can connect you to any of the speakers that have spoken. And both of the this is the second webinar. The first webinar and the second webinar, I put the links. They're also available on our website, so you can listen to both. This will take a couple of days, but you will listen to both webinars and reach out to any of the speakers that spoke at the webinars. But this is a really exciting time, as Professor Abebe, who was the introductory speaker, and Dr. Mehari, who we also worked together during COVID, It's a very interesting critical time for Africa and other sort of emerging markets. Africa has shown in the fintech space, Africa and many African countries are leaders in the fintech space, and innovation has led in Africa in the fintech space, and the rest of the world is following. The same can happen on AI. Thank you so much for your time. Wish you a happy holidays and happy new year. Thank you very much. Bye.
Thank you. Bye.
Bye. Thank you.
Bye.
Bye.